Sin Public Service Commission past papers. So, which of the following medication commonly causes hypoglycemia? Option A to option E. So, the answer here is pentamidine. Why? Because pentamidine is an antiprotozoal. It prevents PCP, that is Pneumocystis carinii pneumonia, which is a very rare pneumonia. What is the mechanism of action of pentamidine? It inhibits RNA and protein synthesis. So, what does it do? It causes hypoglycemia. It is the most common side effect. That is, hypoglycemia is most common side effect. How it causes? Because it damages pancreatic islet cells. The second one is, which of the following test is most sensitive to detect diabetic nephropathy? So the answer is here is urine albumin. This is very simple and we all know it. Regarding features of SLE, so the answer is butterfly facial rash is present in up to 50% of the cases. Then the fourth one is, in patient with chronic renal failure, which of the following is the most important contributor to the renal osteodystrophy? So what happens in chronic renal failure? In chronic renal failure, फॉस्फेट रिटेंशन होती है और 125 डाईहाइड्रो कैल्सिफेरॉल D3 जो है डिक्रीज हो जाता है. सो इट कॉजेज हाइपोकैल्सीमिया एंड दैट कॉजेज hyperparathyroidism. And again, when 1 to 25 dihydrocalciferol receptor decreases, so hyperparathyroidism occur, and when calcium sensor decreases, then again hyperparathyroidism occur. So the answer here is impaired renal production of 125 dihydroxy vitamin D3. Now, which of the following is the most likely to develop destruction of the renal papillae with the concomitant tubulointerstitial damage? So those patients who take analgesics, chronic users of analgesics, end up in renal failure due to renal papillae damage and tubulointerstitial damage. So the answer is D, that is analgesia use. Now, which of the following is the risk factor for carcinoma of the bladder? So carcinoma of the bladder is cyclophosphamide का जो ज़्यादा यूज़ होता है उससे bladder carcinoma होता है. Commonest feature of acute infective endocarditis is fever with changing heart murmur. Right, then the causative organism bacterial meningitis का तो streptococcus pneumoniae है. Pyogenic meningitis में lumbar puncture is mandatory for diagnosis. Then the most common cause of cerebral infarction in our country, cerebral infarction is very common. That is stroke, and that is most common due to the मतलब जो cause है, the most common is thromboembolic disease secondary to atherosclerosis. Regarding liver abscess, pyogenic liver abscess is more common. An 8-month-old boy born to HIV positive mother, the most specific test would be DNA PCR detection. So DNA PCR जो है वो करवाएंगे आप ऐसी न्यूबॉर्न्स में भी और ऐसे जो है 8-month-old बेबीज़ में भी जिनकी मदर्स HIV पॉजिटिव होंगी. An 18-year-old girl presents on the 6th day after the onset of fever. She is likely to have typhoid fever. The best test for diagnosis would be, सो विडाल तो बिल्कुल ऑब्सोलीट हो चुका है और टाइफिडॉल की भी कोई वैल्यू नहीं है, बोन मैरो करवाते नहीं हैं, स्टूल टीआर की भी वैल्यू नहीं है, तो ब्लड कल्चर इज़ आइडियल. Live attenuated vaccine exists for human disease caused by rubella and rubella virus. Child presented with ear infection excluding pus, greenish in color. What is the probable or causative organism? तो Pseudomonas aeruginosa, जहाँ पे भी greenish discharge होता है, Pseudomonas aeruginosa is the answer. So daily we are going to discuss 15 BCQs with explanations.